Hi, I'm Charlene Donavan. I'm a clinical psychologist as well as a psychiatric nurse practitioner. I've been in corrections for about 24 years now. For WellPath, I oversee our Zero Suicide initiative as well as clinical programs that are rolled out nationally across our book of business. The Zero Suicide Initiative actually started what we call in the free world, outside of the walls of corrections. And it was based on a group of folks who were very concerned about rising suicide rates in the United States. And these folks came together and looked at agencies across the country that seemed to have success in lowering suicide rates within their specific agency. And from that work, they identified a series of approaches that these agencies as a group did very well, from top-down leadership having buy-in to reduce suicide rates, all the way to quality improvement initiatives to continue bettering what the agency was doing. In 2016, WellPath took a look at that research and those efforts and opted to be the first correctional company that assumed a zero suicide initiative within the entire company. Since 2016, the Zero Suicide Committee has taken on a variety of initiatives. We're split into about 7 subcommittees. The overall Zero Suicide Committee has about 50 folks. It's multidisciplinary in nature. We have representatives from IT, human resources, operations, somatic medicine, psychiatry, mental health, and we come together monthly as a large committee to discuss initiatives and how to roll those out across the company. And then we have 7 subcommittees that are composed of our committee membership that work on the nuts and bolts of the initiatives. And at any given time, we're working on 10 to 12 programs, from training to CQI data collection to identifying evidence-based treatments that may be applicable into corrections. And then we roll those out, working with our division leadership to ensure adoption and adherence by our team members. One of the things that we try to do in corrections, because we face some additional challenges with our patient population. For example, there are certain clinical presentations that have a higher risk of suicide associated with them. For example, major depressive disorder, bipolar disorder, schizophrenia, substance use disorders, post-traumatic stress disorder, for example, all have higher risks of suicide for patients who are diagnosed with these conditions. In corrections, these diagnoses, frankly, are overrepresented in our patient population. So we really face additional challenges in addressing suicide risk and reduction efforts that are going to be meaningful and successful for our patients. You know, the issue of suicide in the United States has really changed in its scope and content, frankly, over probably a generation. We see suicide becoming a much more acceptable option to problems and solutions that people in the community experience in ways that we have never seen before. The recent research has begun looking at some really individualized factors, such as feeling like you're a burden to those around you and those who love you, and feeling like you're alone and separated from your support network. Those are both key factors for our patient population in corrections. We, by nature of what we do, deal with patients who have been pulled out of the community and placed in facilities where there may not be an access to that social support network. And by nature of being incarcerated, there's a higher risk of feeling burdensome to family members. The other thing that the research has begun to show is a sense of capacity to commit suicide, that thought that I can engage in that behavior and harm myself. What we do every day in the Zero Suicide Committee for WellPath is look at interventions and assessments and factors that specifically help our higher risk population to address those feelings of burdensomeness and that feeling of being alone and separated from support, and work to give them solutions that don't involve suicide as the best option for their problems. There are some really simple interventions that anyone can do, regardless of whether you're working with our patients or you're at home in the community. It's very easy to simply ask somebody, "How are you today? Is there anything I can help you with?" It addresses that sense of feeling alone and not supported. And when you look at studies of patients who are survivors of suicide attempts, one of the clearest trends that emerges is that thought at the moment they engaged in the suicide attempt that no one cared. If I could make one request to address suicide risk, not only in our patient population, but in our loved ones, in our friends, in our community around us, or even in ourselves if we get to that point, the one thing I would ask is simply to be a noticer. Notice what's happening to the people around you, regardless of whether they're family or friends or your patients. Be a noticer. See if something's different. Ask if you notice. It can go a long way to opening the door for somebody to tell you that they're struggling. We focus so much in WellPath about increasing opportunities for our patients to talk to us, to let us know that they're struggling. Be a noticer, create those opportunities with the people around you. It will make an enormous difference. Our goal at WellPath is to put suicide out of business. On behalf of the Zero Suicide Committee and WellPath, we ask you to shine a light on suicide prevention.